Good morning, everyone. I would like to thank SAGES for the privilege of podium. I'm Dr. Sushil Dhungel from KIST Medical College, Lalitpur, Nepal. On behalf of our study team, I'm going to present this study. This study is about the efficacy of antibiotics in bile spillage during laparoscopic cholecystectomy. So starting off with our disclosure, we have no disclosures to report. So a little bit about the background. So we all know the laparoscopic cholecystectomy is the gold standard of further treatment of cholelithiasis. The incidence of the iatrogenic gallbladder perforation during the laparoscopic cholecystectomy is between 6% to 40%. As no antibiotics are administered in the postoperative laparoscopic cholecystectomy nowadays, but postoperative antibiotics are being administered during bile and stones spillage in cholecystectomy, assuming that there may be a chance of the infection in postoperative period. Some studies have shown postoperative courses of spilled bile are similar to those of the non-spilled cholecystectomy if the spilled bile is properly aspirated and the peritoneum irrigated well. But other mentioned postoperative pain, ileus, and trocar site infections, which consequently increases the total duration of hospitalization. So some literature recommends retrieving the lost gallstones to reduce the chances of long-term complications, while others advise to a more careful approach to recover gallstones, because the additional manipulations also could increase the complication risks. Some authors have reported the administration of the single dose or postoperative antibiotics agents after the intraoperative gallbladder perforations as a prophylactic therapy to prevent postoperative complications, but there is no evidence for reductions of infectious outcome after using a prophylactic antibiotics in elective laparoscopic cholecystectomy. So moving to the objectives. So the objectives is to evaluate the effect of the antibiotic prophylaxis on the development of the infectious complications after spillage of bile and gallstones in the laparoscopic cholecystectomy. So in methods, the randomized double-blind control study was our method, in which the patients were preoperatively computer-generated randomly into two groups. Group 1 for administrating of postoperative IV antibiotics and group 2 for without postoperative antibiotics. The study was done between December 2017 and November 2018. The patient who underwent elective laparoscopic cholecystectomy were given the preoperative antibiotics intravenously after induction of the anesthesia. So the injection subtraction was given at the time. The data of the patients with the accidental intraoperative bile or stone spillage during the procedures were recorded in the first pro forma. In methods, the moving to the inclusion and exclusion criteria, elective laparoscopic cholecystectomy with the intraoperative gallbladder perforation was included in our study, and in excluding criteria, emergency cholecystectomy, any malignancy cases, and the cholecystectomy for subtotal cholecystectomy were excluded from our study. So in methods, the pre-randomized patients were divided into the two groups according to the treatment done with or without antibiotics in postoperative period. First group of patients were administered injection ceftriaxone 1 gram 12 hourly for the 7 days, and the second group of patients were managed without antibiotics. The patients were followed up for infectious complications for 30 days in the outpatient clinic. The patient's data, including the demographic, clinical features, duration of surgery, hospital stay, and clinical outcome, were recorded using the pro forma, and data were analytically analyzed. So this is our summary of the methods. So moving to other results, there were 130 patients in total. Among them, the spillage was found in 34 patients. That is 26.15% from the 130 total. And the infectious complications was found in 5.2%. That is 5 out of 34. So in comparing results, the intraoperative and antibiotics groups and the postoperative antibiotics groups were compared. So average age in years were found to be 38 and 38.94 and 38.29. Similarly, the sex ratio is 1.43 in one and 2.4 is to 1 in a second group. So mean weight was 52 plus minus 11 and 54 plus minus 13 in two groups. So the spillage of bile only was found in 15 in first group and the 14 in second group. Similarly, the bile and stone were found in 2 in first group and 3 in second group. So USC finding with the calculus and polyp were found to be 14, 13, 14 and 5 in first group and the 13 and 4 in second group. There is no statistically significant difference between the two groups. Demographic, clinical features, duration of the surgery, and the duration of the study or hospital study stay analyzed in this study. So the consideration of the study groups, the intraoperative antibiotics groups and postoperative antibiotics groups, the operation time was 52 and 54. Surgical infection was found in first group in 3 and second group is 2. And there was no any residual abscesses and there was no complication in 30 days of following follow-up. So there is no major postoperative surgical complications noted in the both groups, but the superficial site infections like epigastric port infection through which the gallbladder had been removed, that was found as a superficial site infection cases. So there are some limitation in our study due to the more exclusion criteria. Only the small sample size was found, so the data were minimal in size. And there was long-term follow-up could not be made in given period of study. It was of 1 year. So for summary and conclusion, the intraoperative procedures like adequate lavage, including without the antibiotics administered, will be effective treatment option for bile spillage in cholecystectomy with acceptable outcomes. It enhanced our experience of antibiotics administration in the case of the bile spillage during the cholecystectomy. Potentially decreased rates of unnecessary antibiotics and misuse of overuse in patients. So in conclusion, the single dose of prophylactic antibiotics administered at the time of the induction is adequate and equally effective as multiple doses of the postoperative antibiotics in ruptured gallbladder during the elective laparoscopic cholecystectomy. So that's my presentation. Thank you all.